The next thing, and this is usually after we've tried lifestyle improvement, we call it lifestyle improvement, is surgical intervention. And there are GI surgeons who specialize in a diagnosis of obesity. This is a fairly extreme last resort kind of treatment that we use for people who have obesity. And in those cases, they have a surgical intervention to reduce the size of the stomach. That's a usually fairly successful surgery for patients to lose quite a bit of weight fairly quickly. And we know that patients who go in to have, it's called gastric bypass surgery, and there's several different kinds of procedures they can do. They can cut some of the stomach out. They can put a sleeve on the stomach. There's several different ways that they can do this, and it's successful in the beginning, but there's some complications. Oftentimes, these patients have surgical wound complications afterwards, because they are cutting through adipose tissue, and the adipose tissue does not have, that's fat, the fat does not have vasculature in it. And so sometimes it's hard for those to heal. They can get something called a dumping syndrome, where they have to sit up after they eat. Sometimes they get very sick after they eat. Sometimes they have a lot of diarrhea. It is helpful to improve type 2 diabetes. Sometimes, as soon as they get out of surgery, their type 2 diabetes is solved. So there's some pros and cons. Obviously, you're going to want to talk to your surgeon about that. Most insurance companies, before they will pay for that, want to see if you have tried some of these other lifestyle options, and some other medical treatments that are less invasive. So, anyways, I hope that helps. And as always, if you have any other questions, leave them in the comments, and I'm happy to answer those.